Have you ever wondered why managing blood pressure holds such vital importance for overall health? Or how exercise, specifically isometric exercises, can contribute to this cause? Well, buckle up, because today's discussion revolves around these very queries. Picture this, the heart, an incredible organ, working tirelessly, pumping blood throughout the body. Blood pressure is essentially the force exerted by this blood against the walls of the arteries. But what happens when this pressure escalates? It can lead to severe health complications such as heart disease, stroke, and even kidney failure. That's where exercise enters the picture. Regular physical activity strengthens the heart, making it more efficient at pumping blood, hence reducing pressure on the arteries. But not just any exercise. Today we delve into isometric exercises, a lesser-known yet highly effective method for managing blood pressure. So, what exactly are isometric exercises? They are a type of strength training in which the joint angle and muscle length do not change during contraction. Intriguing, right? Now, on to the main event, a step-by-step guide on how to perform isometric exercises. The first step is choosing an exercise. Wall sits, planks, and isometric push-ups are all excellent choices. Today we'll focus on the isometric push-up. Begin by getting into a standard push-up position. Lower yourself until your chest is about an inch from the ground. Instead of pushing back up, hold this position. That's it. That's an isometric push-up. Next up, timing. Hold the position for about 10 to 15 seconds initially. Gradually increase the duration as strength and endurance improve. The third step involves repetition. Repeat the exercise 4 to 5 times, ensuring to rest for at least 30 seconds between each repetition. Finally, consistency is key. Make sure to incorporate isometric exercises into the workout routine at least 3 times a week. Remember, always consult a healthcare professional before starting any new exercise regimen, especially if there are pre-existing health conditions. Now, circling back to the main points. Isometric exercises are a type of strength training where the muscle length and joint angle remain unchanged during contraction. They are simple, versatile, and require no equipment, making them an ideal choice for anyone and everyone. Not only are they beneficial for building strength and endurance, but they also play a significant role in blood pressure management. Several studies have shown that regular isometric exercises can lower systolic blood pressure by an average of 10%. That's as effective as some blood pressure medications. So the importance of blood pressure management is indisputable, and the role of exercise in achieving this is undeniable. More specifically, isometric exercises serve as a simple yet potent tool in this battle against high blood pressure. In the pursuit of health, every step counts. So why not make the next step an isometric one? With consistency and determination, the road to better health and lower blood pressure might just be a push-up away.